Hello everyone, welcome back to Langfort International Academy. So we are back with another role play. So today we have picked a topic where we are talking to a 40-year-old patient who had a large carbuncle and it was surgically drained. So the patient has to do the wound care. The nurse is advising all the points to the patient here as well. Okay, so that's the entire scenario. So Nigel will be playing the part of the patient and I'll be handling the part of the nurse. So let's get started.
Langfort International Academy. Your passport to the world of opportunities.
Alright, Richard, so we can start.
Well, Mr. Floyd, your wound has been taken care of. So how do you feel now?
I'm feeling okay at the moment, but I do have considerable pain all around the neck region. Other than that, there are no other symptoms.
Well, I quite understand that. These discomforts are quite common after this procedure, but there is nothing to be alarmed about. It will go off very soon. Okay? So, Mr. Floyd, I'm here to explain the next steps that we are going to do. So, the doctor has prescribed the pain medication for you, and I have arranged the same, so you can take it as and when required. Okay? The important thing you have to keep in mind is to keep the packing on, and also to do the repacking of the top dressing on alternate days. Is that clear for you?
Alright.
But when you do that, it is important that you keep the packing on until your next follow-up appointment, which is 3 days later. So it is important that you keep your hands clean and dry as well when you change the dressing too, to prevent any infections. So I hope you understand the seriousness of it.
I do understand what you're saying, but look, I do not actually want to wait till the next appointment, and I want to regularly check the condition of the dressing, the wound and everything over the next few days, just to make sure that I'm healing properly.
Well, I do understand that you're anxious about the entire thing and you're in quite a distress, but there is nothing for you to be alarmed about, okay? And it is not advisable for you to interfere with the wound right now because there is a risk of damaging the packing, and if it is damaged, it can lead to secondary infection. So it can cause many more complications than the current situation, okay? And also it can prevent the healing process too. So when we consider all these points, it is advisable that you keep the wound intact. Okay, so in the next follow-up appointment, what we'll do is we will remove the bandage, we'll have a thorough examination of your wound, and we'll provide you with some self-care advice as well. Okay, so please set your mind at ease. There is nothing for you to be alarmed about. Okay,
Alright.
so do you have anything to ask me?
Okay, I got a better understanding about the follow-up appointment and all, but still I'm extremely concerned because if I do not do a regular check on the wound, how am I supposed to understand whether it has got infected or not?
See, I understand you have a lot of concerns about this problem, but there is nothing to be worried about because your condition is quite manageable and you are at a low risk of infection as well, because we have given you a 7 days course of antibiotics, which is kind of like a prophylactic use, which is a preventive measure, and we will start it immediately as well to prevent any complications at all. So you don't have to be concerned about anything like that, and you do not have to interfere with the wound every day to see whether it is healing or not, because the medication and the treatment that we have provided you will definitely boost up the speedy recovery.
Right.
Okay, so however, I would like to tell you to seek medical advice in case if you notice any changes like any increased pain, or you start to feel unwell, or you notice oozing of pus or blood from the wound, then it might be indicative of an infection. Therefore, it is highly advisable that you seek medical advice at that time. Is that clear for you?
Yeah, that's absolutely clear.
Well, Mr. Ford, I would like to check with you whether you have made any arrangements to go home.
No, look, I don't think I need that because, look, I think I'm doing quite okay at the moment. I'm feeling pretty confident. So I guess I can drive myself back home.
I appreciate your enthusiasm here. However, it is not good for you to drive right now because you have limited neck movement as you were sedated for the process, and you might experience some after effects of that as well. So touch wood, if anything goes wrong while you're driving, it is most unlikely that it won't be covered by your insurance because we already warned you about the risk factors in it and you try to neglect it. So if anything goes wrong, you might have to face the consequences as well. So I think it would be better if you can arrange something else. Will that be okay?
Well, yeah, in that case, I'll just inform my sister so she can just come by and kind of like pick me up and take me home then.
Sounds good. Okay, so please do that. So do you have any other questions to ask me?
I don't think so. Everything is clear for the moment.
Alright, well, in that case, I hope my job is done here. So I have taken care of your wound, explained all the points about your wound care as well. So as you know that you have a follow-up appointment 3 days after, so I'll see you then. Thank you so much for your time.
Thanks a lot, nurse.
So that was the end of the role play, and I hope it was clear for you guys. If yes, please let us know in the comment section, and Nigel and I will come back with more videos very soon. Take care. Bye-bye.
Style.